Welcome. We're glad that you could join us for this discussion. I am here with Dr. Bill Payne. Dr. Payne is Professor of Evangelism and World Mission, and he is also the Director of Chaplaincy Studies at Ashland Theological Seminary. We're here today to talk about the role of clinical pastoral education in the discipline of chaplaincy. Bill, welcome. We're glad that you could join us.
Thank you, Matt. I'm glad to be here.
Wonderful, wonderful. Well, I'm looking forward to this discussion. So let's start by a very basic question. What is clinical pastoral education, and why is it important for chaplaincy students?
Clinical pastoral education has a long history in America, going back about 100 years, and it was developed in response to the need to make chaplains be able to respond to the holistic reality of human beings. When you do CPE, you are learning about yourself. It is a way for you to become objective, self-aware, and to grow in your own sense of professional identity. When we do CPE, the person with whom we're doing our ministry is a living human document. And we're doing quality ministry with that person, and we're doing it in a supervised manner, and it's very appropriate. But in reality, we step away from that. And that ministry that we do with that other person becomes a light into our soul. It becomes a light into who we are. And we begin to reflect upon that individually with the clinical educator, with our peer group, and they ask questions. We write verbatims about our ministry, and it really begins to grow us in our self-awareness about faith, about others, and about our own assumptions about life and ministry. So CPE is a learning process. It's 400 hours long, and that's for one basic unit. And it includes 100 hours of didactic within that 400 hours. It is, for those who use it, it becomes the field education program for their degree.
Okay, so this is the field education part of this, I think, is critical, right? This is really that field experience that chaplaincy students are getting.
Yeah, Matt, that's true. Those who don't go through chaplaincy will take another form of field education. But let me emphasize, CPE is not just for chaplains, it's for pastors too. When I was preparing for chaplaincy ministry, I did CPE, but I also, before I went full time into chaplaincy, I went into the parish. I was a pastor for many years, and many seminaries use CPE as their field education program. So you don't have to be going into chaplaincy per se to benefit from CPE. Anybody who wants to become a more competent pastor, understanding pastoral care and counseling and how to interact and grow in my own self-awareness would benefit from CPE.
Very good. Very good. Because chaplains are pastors as well, right? They are pastors within their context.
They are pastors. They're shepherds to the people to whom they are working. They're guiding them, and they're providing a full program of pastoral care and ministry.
Very good. So you mentioned a unit of CPE. So CPE is taken in units. You said 400 hours for each unit. How many units should a chaplain have?
That's a great question, and it depends on the type of chaplaincy that the student wants to do. Let's say that all chaplaincy requires some form of CPE. If you're going into prison chaplaincy, for example, at this point, you only need 1 unit of CPE to work for the state of Ohio. But if you're going to work for the Federal Bureau of Prisons, you need 4 units of CPE. Most people, if you're going to work in a hospital, for example, and get board certified, you're going to need 4 units of CPE. However, some people who go to work for hospice or long-term care programs or something less than those other examples, they can get 1 or 2 units. However, today the industry is moving more towards the 4-unit model.
Okay.
So I would say to a student who is considering chaplaincy, be careful that you understand what type of chaplaincy God is calling you to do and prepare for that type of chaplaincy. 4 units is the normal model, but it's not required for every type of chaplaincy.
Yes. And of course, since you're the director of the chaplaincy study program at the seminary, as an advisor, you would be able to work with students in terms of what kind of CPE they would need based on their career goals.
Absolutely, Matt. And one of the good things is I am the advisor for every chaplaincy student, and we meet every semester to talk about those type of issues, to understand your calling, to assess where you are in that process, to help you decide the next steps, and to connect you with people that you need to know to make progress in your career goals.
Hmm.
When you think about the process of going forward in chaplaincy, it is important that you do CPE with the right organization. And I kind of help my students decide where they want to do their CPE. There's a
Hmm.
lot of ways you can do CPE, Matt. You can do it in a traditional hospital. You can do it in a children's hospital. You can do it in an oncology place. You can do it from a parish. They have parish-based CPE. You don't have to do it in the hospital. Or you can do it through a prison organization by aligning with another CPE unit that will sponsor you for your clinical portion. And so, yeah, it's important that the student work closely with me as I advise them and push them through the process. Nobody gets left behind. Everybody comes out at the other end ready to move on with their career.
Very good. Well, that leads me to the next question, Bill. You talked about the different types of, the organizations that you can do CPE. So are there obstacles for chaplaincy students in obtaining CPE? And if so, what are those obstacles?
There are obstacles. CPE is usually given in a full-time capacity for 12 weeks, 11 to 12 weeks. Most of my students will do their first unit of CPE in a summer unit, and that unit will consist of 40 hours a week, and they all work at the hospital. And I think it's good to work at a hospital to do one of your units of CPE. That's the normal place that CPE normal happens. Um, some students have jobs, they have family obligations, and they can't quit their job to do a full-time CPE.
Mhm.
And we appreciate that. There's a way to get around that, and it's called an extended unit. An extended unit can go over in, let's say, a whole year, and you can get it down to as little as 15 hours a week, depending on the program that you apply to. And those programs are available. And so if a student has a job that they have to do in order to feed the family and keep everything working, then we will work to find them an extended unit that meets their needs. So the time issue is the larger problem. The good news is after you do your first unit, and if you decide to go on and complete the other 3 units, normally that's done as a residency. And if you're doing a residency, you get paid. Not only do you get paid, you get benefits and allowances. So what happens traditionally now is that a student will do a basic unit in a summer while they're still in seminary. They graduate from seminary, they go to a residency, they do a 1-year residency, and they get $32,000 plus benefits, healthcare and all that stuff. And from that residency, they will get board certified and they'll jump off to their first job. That's the springboard to your first full-time job after the residency. Some students say, I'm not ready for a full-time job. I want to go and I want to do a second residency, a fellowship in some kind of specific chaplaincy, like oncology or women's medicine or something like that. And so chaplains also specialize in different types of ministry.
Well, that's very helpful information, Bill, especially about the extended units of CPE, because I imagine there are some folks who would say, I want to be a chaplain, and then they look at the requirements for CPE and kind of dismiss it as if that's more than they can handle, and there actually may be ways that they can go ahead and get their CPE.
Yes, we can always find a way. There is another way, Matt, that we haven't talked about, and that is online CPE.
Hmm.
Online CPE is a great option for the working student, especially if that student is already doing ministry. Let's say you're a youth minister, or you are a hospice chaplain, or you're doing something already that's really meaningful. And so you find an online unit, and that online unit then will provide you the structure to do CPE, but your contact hours will be in the ministry that you're already doing, vice the hospital where the CPE director works. And there are places you can do this. So if I'm pastoring a church now and I want to do a CPE, so I will find a program that will allow me to do my didactics and my one-on-one and everything else, that 100 hours with a online program, and then the 300 hours of contact will be in the ministry setting that I have.
Wow, that sounds like a very viable option for a lot of folks.
It is. And we just need to make sure that people know that that's out there. We have to find those options sometimes, but it's out there. Uh, on the online community, you can do your CPE program can be based in California. The United Methodist Church has a virtual CPE program, and their director is in California. This is an example, and people from all over the country take CPE through that person while doing ministry in their own local churches.
Wonderful. Well, Bill, that's very helpful information, but it leads me to the next question, which is, if I was a student in Ashland Theological Seminary's Mdiv and Chaplaincy program, how would the program help me as a student integrate CPE?
We give credit for CPE. So a student who comes to us with CPE already completed, we will, if that CPE is listed on a ACPE transcript, which it will be, and you have not used that CPE to get credit in another university, we will take that CPE credit and bring it into your transcript as it is. And so you'll get 6 hours of credit for that one unit of CPE. Then if you do additional units of CPE while you're still in the program, which you can do, each one of those other 3 can count as a pastoral care and counseling electives. So you need to have CPE and 3 pastoral care and counseling electives to graduate from the chaplaincy concentration. And so CPE can count towards those electives. The traditional student will graduate, get the 1 unit of CPE, graduate, and then go do a residency. That's fine, but you don't have to do that. You can take your CPEs while you're in seminary, 1 at a time, as extended units or in the summer, or you can take some before you come to seminary and then transfer them into your program.
Well, that's great. I mean, so, CPE is something that chaplains need to have, and they can go ahead and get credit toward their degree while they're earning those.
Yes, it's not lost time. Everything counts.
Wonderful.
And it counts for you, and it counts towards your graduation credits.
That's great. Well, I have one last question for you, Bill. If I wanted to become a chaplain and I was interested in Ashland's chaplaincy program, what would be a couple of strengths of the program that would benefit me in becoming a chaplain?
I think Ashland has one of the best programs in the country. Our program was developed around the functional areas of chaplaincy. We didn't just pull some courses together and say, hey, we got a chaplaincy concentration. Our core curriculum reflects the very things that chaplains need to know how to do. And our core curriculum will prepare a prospective chaplain for every aspect of that job. They will know what to do. For example, the model that we use is a chaplain has to provide for people of his own faith, facilitate for people of different faiths, care for all people, provide spiritual care for everybody. A chaplain's a chaplain to everybody, not just to people of her or his own faith, and be a subject matter expert in all matters related to religion, culture, and ethics. So we created a mapped out curriculum for chaplains that prepares them for every one of those jobs. And when you walk away from our program, you're ready to walk into chaplaincy. You're fully equipped. We realized the reason we have a concentration in chaplaincy, Matt, is because we know that some of the end goals of chaplaincy, some of the student learning goals are different from that of a basic pastor. And they need to know some stuff that a pastor doesn't need to know. And so traditionally a student will get an Mdiv and then go do a CPE and learn by trial and fire how to be a good chaplain. And that's what I did. But we don't have to do that. We have enough knowledge now that we can create a chaplaincy concentration that will prepare you. So I think that's the big distinctive in our program. We absolutely prepare. Plus, our program is connected to all the CPE centers. I know the people who run them. I direct my students to the right ones. And most of our students, when they leave us, either go into a residency or go directly into a job. It is a pathway to where God wants you to go with your ministry. We don't leave you dangling afterwards like, what am I going to do? Because chaplaincy prepares you for a job. And the good thing is, Matt, that there are chaplaincy jobs out there.
Yeah, there are. Well, Bill, that sounds very appealing, and it seems obvious that, and of course, I am familiar with the program. Certainly has been tailored to meet the needs of students that want to become chaplains. So appreciate your time. Thank you so much for spending a few minutes to discuss this, and certainly know that the information will be valuable for anyone that's looking to go into chaplaincy. Thanks again, Bill. I greatly appreciate it, and I'm sure I'll see you soon.
Thank you, Matt. Bye.
Bye.